what we know we're dealing with right now is some kind of scarring in your lung that is progressive. And it's already getting bad, and what Dr. Lee and I are worried about is that this is going to keep getting worse. That's not what we want. We can't afford for this to get any worse. We want to try to reverse it. Now, we haven't cracked the case yet. Even when we looked at it under a microscope, Dr. Lee and I and Dr. Travis and the pathologists here are still kind of debating exactly what this is. My opinion is that this shows that some of the scarring is permanent, but some of it is actively still going on. So one of the first steps that we're trying to do is to figure out, why is this going on? What is it that's causing your lungs to still form this scar? And that's why we've been asking you a million questions. We've put you through 20 questions to try to find out what it is. Because in some cases, it's something, that you inhale, it's a pet, and you have an allergy to it, or an infection, or a toxicity from a medication that you're taking. So far, we haven't figured out what it is, and we're now going to run some more tests, okay, to try to see if we can figure out what it is, okay? Hopefully, we'll have some more answers, because now there are some more clues, but these are not good clues. The clues are the bone marrow. This has been going on for a little while, but the bone marrow is not in top shape. It's not working at 100%. And we don't know if these two things are related. So I definitely want to hear what Dr. Sundram has to say about this. And the other thing that we're going to have to keep an eye on is the kidneys. The kidneys also look like, well, maybe this is affecting the kidneys too. And we don't know if this is the same thing or not, but we have to run some more tests. Right. And then eventually, within a week or two, we're going to have to start making some decisions. Our hope is that we're going to have a definitive answer. But I can tell you that there have been many situations like you before. I've taken care of people like you before, where even after we've asked every doc in the country and in the state to see what they think, we can't figure out what it is. In the year 2012, sometimes the doctors don't have the answers. So sometimes we have to start trying things. And that's like the prednisone that we were talking about. And all these medications have side effects. So we don't want to have to do it unless we absolutely have to. But we may find ourselves in a few weeks stuck between a rock and a hard place where we may have to start trying things. Okay? Any questions about that so far?
Can you just clarify the liver and all that?
So, talking about the liver
too. Yeah, so we just don't know. What your blood tests are showing is that the liver has inflammation. Inflammation just means that something is irritating the liver. We don't know what's irritating or how much. It doesn't look like a lot of irritation. It's a mild amount of irritation. But what we do is there's certain proteins that live within inside of liver cells. And when we measure the blood, you don't find a lot of that protein in the blood. But when the liver gets irritated, it starts secreting off some of these proteins. It's like crying. It's like tears coming out of the liver cells. And that stuff floats around in the bloodstream. And then when we measure it, we see that that level is a little elevated. So it's not very high. When people have really bad liver injury, the numbers are in the thousands. So like when I take care of people in the intensive care unit, those levels are thousands. One of yours was like 140, I think, or something like that. So that's a mild amount. And that could be nothing. That could be a little virus. If I had a little flu, that would irritate my liver a little bit. It'd have to work harder to clear the virus, and that might bump up. So we're going to probably have to repeat that blood test in a little while to see, was that like a little bump, or was that a continuous thing?
It's a little bump or a little bump.
Yeah, he was
we don't know.
He did get a flu when he was in the hospital, and then he was sick.
Yeah, you got the
before that too.
Haemophilus influenza. And it may turn out that a lot of the little blood tests that we see as abnormal and we're freaking out over, it may turn out that when we retest them in a few weeks, they all go back to normal. Because when the body is sick, even if it's a respiratory issue, it does affect the kidneys and it affects everything. So 2 weeks from now, we may find that it's all normal. But then again, we might find out 2 weeks ago that whatever this process is, it's affecting the kidneys. And this may be something genetic. I mean, there are other people in your family that have had lung mysteries. And so this may be something in the genes. So this may not be something that is from the environment that's infecting you. So I apologize that we don't have any answers, but I can assure you, we're asking every doc that we can get a hold of what their opinion is. Do they have any other thoughts? Are there any other blood tests we can order? How can we get to the bottom of this? Because I want to get to the bottom of this within a matter of a few weeks.
Yeah.
I mean, that's the bottom line.
Exactly.
Okay, good questions. What other questions do you have? Anything else you can think of? I know it's frustrating.
Do you want us to document? I don't know how much he has documented or gave you guys, like what he has done in the years, so you can kind of
Sure.
go back and check and see.
Any clue, you know, a lot of it might not be relevant, but we're like detectives, okay? And sometimes you send us a clue. You know, I've had patients before that have had something like this, and then all of a sudden they were talking about their pigeons in their backyard, and I go, you never told me you took it. Oh, they're just, yeah. And it turned out that it was a hypersensitivity pneumonitis, basically an allergy to pigeon feathers. So sometimes there's a weird clue. There was a guy that used to load his own bullets, his own shot, downstairs in his basement, and so he had lead and all the gunpowder and all this stuff. He never told me that. I tried to ask him, like, what are your hobbies? Do you do anything weird? It's not weird to him. His dad did it, his brother, everybody. He thought that everybody loads bullets. Well, that's not normal. I don't load my own bullets. I don't shoot it either, but... But so there may be something that you think that's as normal as drinking a Starbucks to you, but when you write it down, we may look at it and go, oh, I didn't know that you took, I don't know, some vitamin, mineral supplement, an ointment. You know, there may be something that's just so normal for you to eat or drink or use that you'd say, oh, doesn't everybody use echinacea with gold seal or something? And it may be that, oh, that's the clue that may help crack the case. I don't know. Or it may be something from the records of your sister from Texas. You know, who knows? I wish I had more answers. I really do. I can tell you. But we're going to work real hard. I know that Amy's been calling every doc in town and asking everyone. So we're not taking this lightly, okay? We're going to work real hard for you. That I can promise you. All right? And if you have any other questions at any time, you call us anytime, you email us anytime through the MySharp. You can email Dr. Lee. And you know, anything that comes up, you let us know. Keep a diary of anything you can think of.
Well, that's what I've been trying to do, keep every record of his
That's good.
medical checkups and
I
all this
agree.
stuff. And I even found old files, and I thought, oh, I better put it all in now.
Yeah, you never know.
Yeah, exactly. So.
All right, and until then, we were talking about the acid reflux. Amy has a sheet, once I stop yabbering, that she's going to give you. I was telling her, we have a case, one of the other senior partners, Dr. Cavey's been doing this for 20 years. He had a woman that he took care of 10, 15 years ago. She had the scarring in the lung. He did every test known to man. He did a bronchoscopy, lung biopsy, everything. He actually referred her to UCSD. Dr. Young, things were getting so bad, he thought she needed a lung transplant. So she goes over, she sees Dr. Young. Dr. Young's this kind of crazy Asian guy I hope you never have to meet. And he came back, he called up Dr. Cavey and he said, oh, you need to put her on an acid reflux medicine. And Dr. Cavey was saying, you gotta be crazy, what are you talking about? But it turned out that she was having heartburn. We all have a little bit of heartburn. And the stomach acid from her stomach would roll up the back of her throat at night, and some of it, this is the tube that carries the acid, it rolled up the back of her throat, and a couple drops got into her windpipe. That happens to everybody. Sometimes I'll drink a little bit of water and choke on it, you get a little bit of saliva, and most of us cough it out and there's no problem. But for her, that was scarring. What is that? Yeah.
Wow.
Yeah, it was unbelievable. So once she got on these medicines to reduce the acid, she elevated the head of her bed, she did all of these other things that maybe Amy talked to you, or she will in a moment. That was 10, 12 years ago. Most of the scarring she had didn't go away, but it's not getting any worse, and she's totally, relatively fine now. So it may be something like that. So, we leave no stone unturned. Okay?
Sounds good.
I know it's not as satisfying as you'd like, but it's a start.
Thank you
So
very much.
pleasure meeting you.
Pleasure meeting
Okay? Any other questions that you can think of right now?
Maybe not now, but now that
Write 'em
wheels
all
are
down.
turning,
Write
You
'em
can
all
email
down.
us.
Yeah.
Absolutely.
And is this your copy? Is this his copy or your
Actually, I
copy?
have
Steve?
a copy, so if
Oh,
you'd like that,
okay.
you can take
Yeah, I'll
it.
take that with me.
Put that in your record. Hopefully, we'll get this fixed, and then 20 years from now, some doctor will do an X-ray. You'll have a little bit of scarring and say, "Oh yeah, 20 years ago, these stupid docs couldn't figure me out. Here's the results of my biopsy."
Exactly. I hope so.
All right.
Thank you very much. Appreciate it.
Okay. See you soon.
Okay.
Thanks so much.
All right. So now that it's after 5, you'll probably have to come back to do the lab work because I think our lab's gone.